A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
He put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
And good afternoon, and happy Valentine's Day. Everybody's out running around, getting ready for dinner plans and getting gifts for loved ones and enjoying time together. It's pretty awesome. McCrae Elliott, my board operator. Good morning, good afternoon. And this today is actually, this is going to be one of my favorite shows. I love all of my shows, but this one is actually, I have my mentor online with us today. And this gentleman has taught me everything I know about neurofeedback and actually extended some of my training from the University of North Texas, the program they had there. But let me kind of intro into what our program is about today. Today we're discussing a particular type of biofeedback called EEG biofeedback or neurofeedback that is used to treat ADHD, seizure disorders, LD, and much more. So my program at the Center for Biofeedback and Behavior Therapy is biofeedback. Now I'm going to get into explaining like what exactly that is because it's pretty broad. But in a nutshell, it kind of tells you this is using electronic assisted equipment and technology to train the brain and teach kids and adults how to control their body, to control their emotional response, and actually teach ways of focusing or training ways of improving reading abilities and math abilities. So let me finish up this little intro. Neurofeedback is currently being investigated by the National Institute of Mental Health, and the strategic plan for research is Brain Research Through Advancing Innovative Neurotechnologies, or BRAIN Initiative, headed by Thomas R. Insel, MD. So joining us today is Joel Lubar, PhD. He is a professor emeritus from the University of Tennessee and the director of the Southeastern Neurofeedback Institute. He is the past president of ISNR, AAPB. He is BCIA EEG Senior Fellowed, which is pretty substantial in the field of BCIA and being actually certified as a biofeedback practitioner, a therapist. He's a licensed psychologist and is listed in the National Register for Healthcare Providers in Psychology and is a QEEG diplomat. So our format for the show today is the first segment. We're going to talk about the history of biofeedback and neurofeedback and get to know a little bit about what Dr. Lubar's work, his early work has done, and how it's kind of evolving. As we move into the second segment, which is what is neurofeedback and what it's not, current trends in brain imaging and treatment in the treatment field of Loretta and fMRI. Then we're going to discuss adjunct therapies, such as family therapy, counseling, peripheral biofeedback, and drug addiction treatment. And in the fourth segment, we're going to open up the phone lines and see what sort of questions you might have for Dr. Lubar. The phone number for our call-in, our guest line, is 214-866-8400. Again, the guest line is 214-866-8400. And so without further ado, I want to welcome Dr. Lubar onto the show. Good afternoon, Dr. Lubar. How are you?
Good afternoon. Happy Valentine's Day to everybody.
Happy Valentine's to you as well. How's the weather over in Deerfield?
It's very nice. It's about 70 degrees and sunny.
Dr. Lubar joins us from Deerfield, Florida, and that's where he actually is. He runs his clinic. He's the director of the Southeastern Neurofeedback Institute. So, Dr. Lubar, this particular approach, neurofeedback or EEG biofeedback, is consistently been it's been scrutinized, it's been criticized. Historically, it's been looked at, as charlatanism. It's been through a lot of evolution, and so even myself, when I first heard about it, I was skeptical myself until I discovered your work and also the work that was actually being I was being exposed to through the University of North Texas in Denton. But that there is an academic component and a scholastic component to neurofeedback that's grounded in research. But then there is also a lot of other attention to it that's essentially it's very charlatanesque and it's not regulated. And I think that a lot of individuals have over the course of time have kind of smeared its reputation. But can you tell us a little bit about, just give us a definition of what neurofeedback is to our listeners so we can get an idea of what we're actually discussing today?
Okay, well, neurofeedback is a technique for training individuals to be able to alter brain function. We look at several different things. Primarily, the electrical activity of the brain is measured by the EEG or electroencephalogram. And there's also another form of neurofeedback where you can train individuals to change the blood flow patterns to different portions of the brain using what we call functional magnetic imagery, or even measuring using what's called near-infrared spectroscopy, the blood flow patterns in different brain areas. And there are literally hundreds of applications of all of these forms of neurofeedback. This work goes all the way back to the 1960s. And in fact, our early work with neurofeedback was in the area of controlling epileptic seizures. And that work has continued to develop in many areas, being used in laboratories and clinics all over the world.
Yeah.
And there are a number of people in this country who are what we call epileptologists. These are neurologists who specialize in epilepsy, who incorporated EEG neurofeedback training for patients that are resistant, have seizures that are resistant to medication.
Mm-hmm. And a lot of times this treatment is not necessarily a replacement for it, but can actually be an adjunct too. And also just discussing, going back to what you said a little bit about the history, Harvard University had a program in psychophysiology that was in 1976. And in fact, and I know a lot of the research I did last summer, I was reading about Harvard Medical School and how they continue to use EEG biofeedback and perform biofeedback research even to this day. So it's a pretty prominent approach, but you just don't hear about it these days very much.
Well, actually, there are well over 5,000 publications in mainline medical, psychological, and journals in the healthcare field. As I said, going back to the 1960s, that involve both clinical applications of neurofeedback as well as research studies to validate it, and it has been cross-validated with many other techniques. I will say this, it's not a technique that you stand alone in the sense that you just connect somebody to a device and measure their brain waves or their blood flow patterns and train them, and that's all there is to it. It is part of a multi-dimensional program which will involve psychotherapy, medications, other techniques all working together. Mm-hmm. In many cases, the biofeedback and neurofeedback are often the strongest component. We had a program in a major hospital in Knoxville, Tennessee when I was at the university for 8 years working with chronic pain, severe chronic pain, using biofeedback, and that was the strongest part of the program, which also involved anesthesiology, nerve blocks, sometimes neurosurgery, psychiatry, and counseling. Mm-hmm. Biofeedback was kind of the centerpiece of that program.
And it actually is the same these days in a lot of these clinics. Like you hear about the Amen Clinic doing things that involve neurofeedback and biofeedback. Biofeedback and neurofeedback, it's a lot of times those terminologies kind of get thrown around a little bit. And could you explain to us the difference between those two?
Well, actually, neurofeedback is if you look at it this way, biofeedback, feedback of biological information about the body in order to alter some kind of, either disease process or bodily function. So it involves measuring of muscle activity and training people to change it, blood flow patterns in different areas of the body, and other responses, respiration, heart rate, heart rhythms, and so on. And neurofeedback is a subset of that. That's involved specifically with training individuals to change functions within their nervous system. So neurofeedback is a subset of biofeedback.
And so biofeedback and neurofeedback essentially, they umbrella under the same terminologies of just using equipment to kind of train particular parts of the body. If you're just joining us, we're visiting with Dr. Joel Lubar. He's the director of the Southeastern Neurofeedback Institute in Deerfield, Florida. We're going to take a commercial break. We'll be right back after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hello, happy Valentine's Day. We are back. We're discussing neurofeedback treatments and assessments with Dr. Joel Lubar. He's the director of the Southeastern Neurofeedback Institute in Deerfield, Florida, and he's my mentor. Neurofeedback, children come in, you place a small sensor on the cranium at a designated spot. They're looking at a computer screen, and every time they produce a response, either we're teaching them how to concentrate, we're teaching them how to control their body, or we're training a particular rhythm in the brain, it generates a signal which can then be picked up by a sensor, which then feeds back into a machine, and it pushes a little animation around the screen, neurofeedback. And then our assessment, the more modern way to assess is called a QEEG brain map. And this is where we actually take a child, an adult, a patient, and we place a cap on their head, and it has these electrodes that are distributed into what's called the International 1020 system. And it's recording, from 19 different sites simultaneously. And so we take that sample and we plug it into a normative database. It pulls up a collection of maps according to that individual's birth date. The normative database is a collection of maps of individuals who have normal IQ, no known diagnosis, no known learning differences. We superimpose that map, the patient's map, over the collection of maps according to the birth date, and then they show up in this report called a topograph. And you're looking at these coloration patterns, and it kind of gives you a little map as far as like where the differences are and what particular function that region of the brain is associated to. That's a QEEG brain map. So, Dr. Lubar, so what is neurofeedback and a QEEG brain map, and what is it not? Can it treat everything?
No. We have what is called a large database of hundreds of individuals of different ages. Actually, the database starts from 2 months of age all the way up to age 82, and it's one of many databases of this kind. And what you can do is to evaluate, with, again, 19 channels, the electrical activity, the EEG, and then there are many measures that have to do with the frequency, number of waves per second, how large the waves are, and then measures of connectivity between different areas of the brain, how the waves travel from one area to another, which areas are involved in different tasks, and so on. Now, what we can do is then look at a database for approximately 150 different disorders, such as different types of attention deficit and attentional disorders, executive function, depression, anxiety,
epileptiform,
brain injury.
And you can see epileptiform as well.
Epileptiform. There are many different disorders in which there is substantial published data, hundreds of papers in good journals that say that for individuals, let's say with depression, there are certain patterns associated with depression. Now, if you are able to use neurofeedback to normalize those patterns in conjunction with, if appropriate, medications, if also appropriate, different types of therapeutic interventions, you can get excellent results. Let me just give you one quick example. There was a study done in the 1980s, replicated. We did a study also which replicated these studies that showed that patients that had been in psychotherapy and had been on antidepressant medications for up to 20 years with some progress, not very much progress, when they did the EEG biofeedback, EEG neurofeedback training, they were able to substantially improve measures of depression, in some cases being able to decrease and even eliminate medications. And then a follow-up study was done on these same patients 10 years later, and the majority of them were relatively free of depression. Now, that type of result has not been able to be achieved with other techniques because you're actually changing the way in which the nervous system processes the different areas of the brain that are involved in the depressive disorder. And that's just one example. I mean, there's anxiety, obsessive compulsive disorder, and so on. Many different examples of this.
And I remember Russell Barkley. He's a tremendous ADHD guru, if you will. He's a great resource, and he was always skeptical of this approach until he read a Dutch study that actually showed some pretty substantial effects and some pretty substantial results. And then he started to kind of scratch his head and says, this is pretty compelling.
Absolutely. I mean, I know Russell Barkley. I've been on panels with him. Basically, his point of view is that you want to validate something. It's not enough to have testimonials. You have to have controlled, double-blind studies and large multi-center studies that show that the effects are stronger than placebo or other treatments. Now, at the time that back in the 1970s and early 80s, these studies there were very few of these studies, and so Dr. Barkley was quite critical of the technique. But now that these studies have appeared and are showing that neurofeedback is very, very powerful, he's becoming more and more supportive. I think actually he's retired at this point, but other people who used to be somewhat skeptical are now supporting it. And there's a large National Institutes of Health study, several $1 million, supporting a multi-center study, which is in effect now, to validate the effectiveness of neurofeedback for attention deficit disorder in children. That study will be completed in 2 more years, and then we will know the exact results because it is a double-blind study.
Yeah, and you can even pull up, you can go to Google and you can type in brain mapping and Obama, and you can actually see that there's a lot of trends are actually moving to the brain training and brain imaging researches. And there's actually now they've delegated, the White House has delegated several $1 million as funds to investigate this approach, and several others such as fMRI and so there are other. It's a massive movement, and it's now starting to kind of come into fruition. And I think that a lot of people are going to start hearing a lot more about this.
Well, the technique that we developed, we were the first ones to ever treat ADD, and we were the first ones to develop a technique called low-resolution electromagnetic tomography, or LORETA, LORETA, which is an acronym. This allows us to train the generators inside the brain that produce the surface EEG distribution. And it's because we can do this, and about 80% of the brain can be imaged this way, we can get at areas that we could normally not get at with traditional neurofeedback years ago. Areas like the hippocampal formation, which is involved in memory function, and other areas that are involved in the control of internal organs and so forth.
So now it goes beyond just surface activity.
It goes beyond the surface significantly, and there are now hundreds of studies and papers coming out cross-validating this technique with fMRI, SPECT scan, PET scan, and other measures.
That's phenomenal. And these are studies that are actually, this approach is actually one of the new ones. And actually you trained me with this particular Reddit. It was really fascinating because was the trend before. You'd either take a common treatment where you'd hook up a single sensor. It's called monopolar or two sensors, a bipolar sensor, and you'd go around and you would actually trace the different areas, measure out where the substantial area was, and you would train that one region or two regions. But now with Loretta Z-Score, you're wearing the map, and you can actually train all 19 sites simultaneously, but not only to the surface activity, but now to areas that are deeper function, like the coherences, where you have too many areas of the brain that are communicating with each other. Phase lag, how efficient information is being transferred from one part of the brain to the other.
And how rapidly it moves from one area to another, and what direction it moves.
And so this is where it's all going. And I think a lot of people don't know, or they're just now learning about this, and it takes a lot of educating. Do you find yourself having to educate a lot of people a lot of your patients and families on this approach? I mean, they can research you and see that you've been doing studies since the 1970s, and you've even done studies in conjunction with a partner for NASA. And so, the history of the things that you've done with this field has been pretty substantial, and this is now the new front. So do you find yourself educating a lot of people on this approach?
All the time. I mean, I do a lot of workshops, a lot of professional training, a lot of counseling with patients. I'm involved in a very large addiction center where I set up the Loretta Neurofeedback programs, and these are people that are adolescents and adults with multiple addiction disorders. In fact, in our county, Broward County, Florida, there are over 130 addiction programs. So, drug abuse is, prevalent all over. But this particular program, we introduced Loretta Neurofeedback, and the patients are doing incredibly well compared to where they were before in terms of fewer relapses, better adjustment, and then integrating this with the therapy programs and family programs.
Yeah, and that's going to be our next segment, which is the adjunct therapies. Mm-hmm. But as far as like the way Loretta is working, do you see more? You actually run a center that trains individuals. Are you seeing a trend of more people actually seeking out Loretta training?
I'll tell you one of the reasons why what's going to happen now. These electrical, the caps that hold the electrodes or the sensors that we put on the head. You have to inject a little bit of gel paste into each one so we get good contact with the skin. Mm-hmm. The new development now, it's moving along very fast, is to develop a device like that, which you can just drop on the head very accurately, hair and all, and it can measure. It's called a dry electrode, dry sensor. These are being developed, and they are successful. They're expensive, but we hope the prices will come down. This will make a huge difference. And the reason I mention this is because, there are a lot of ladies that come in, their hair is nicely done. They don't want paste in their hair. These devices, you just drop them on the head accurately, and you're ready to go in about 2 minutes.
Yeah, that's a game changer for a lot of people because I think that there's that can actually make a big difference. I know when a lot of kids finish this type of treatment, there's a tremendous amount of electrode gel. And that can be a kind of a messy process. If you're just joining us, we're visiting with Dr. Joel Lubar. We're going to take a commercial break. We'll be right back after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we are back. Joining us today is Dr. Joel Lubar. He is the director of the Southeastern Neurofeedback Institute in Deerfield, Florida, and he is incredibly and has historical significance to the field of biofeedback. He's my mentor, and he's what we would call in the field a pioneer. And so he's visiting with us, and we're discussing EEG biofeedback or neurofeedback, brain mapping, and now we're moving into this segment called adjunct therapies. But before we move into the segment, I do want to open up the phone lines. The guest line is 214-866-8400, and invite you to call in with some questions and visit with Dr. Lubar for a bit. Adjunct therapies, Dr. Lubar. So in addition to neurofeedback or Loretta Z-Score biofeedback, there are other things that can be done because it's not just one approach. It's not just the one approach that you're relying on, and we're putting a lot of pressure on it, but there are several things. I mean, if you're going to go fishing, you want to cast a pretty wide net and address several things. What typical types of adjunct therapies do you see with neurofeedback, or would you recommend with biofeedback?
Well, let's take one particular area, the area that I've developed over the years and that Rusty Lozano is working with extensively, and that's attention deficit hyperactivity disorder in its various forms. And as you know, ADD can be very disruptive. If you have an ADD individual, a child, very disruptive in the family structure. There's a lot of competition between that child and with their other siblings, and problems of interacting with the parents because of the behavior problems associated with it.
Mm-hmm.
So in our clinical work, we always brought the whole family in, and we had many times we would have sessions with the child by himself or herself, and the child with the family members, and sometimes even with the extended family members. And it's important for the family as a whole to understand exactly what we're trying to do for the individual that has the attentional problem,
right,
and to try to integrate this into the family so that interpersonal relationships at home improve markedly, so that there isn't this competition and battling between various family members because of this child's problem. And also to work with the teachers, and we have counseling with the teachers as well, so that what we do for the neurofeedback will transfer. The transfer of the training from the clinic to the real world is the most important of all things. Otherwise, you get a result which works only when they're in a therapy session in
Correct.
the clinic, but doesn't work anywhere else. It has to transfer.
Absolutely. That's the generalization component. And you bring those family members in because usually a child that struggles with ADHD or some sort of developmental component, it requires a lot of attention. And so you may see like a mom be more of her attention is actually going towards this child because it's being drawn that way. It may kind of keep the other siblings kind of off to the side and create some discourse even between the married couples. So
It happens all the time.
It happens quite a bit, and I think that families may not realize that until it's too late, or until they've created an issue and they say, "Okay, we all need therapy." And in knowing that there's one aspect of that that's a vector, and that is the child with the symptoms and the issues, and maybe not enough understanding and realization that things are different, and so therefore our family's going to be different, and we need to kind of address things a little differently than we have been.
It even becomes more acute when we're working with in our addiction program, because many of these individuals have had severe abuse, both physical, sexual, or otherwise, in growing up. Many of them have been rejected by family members, especially when they started using drugs or alcohol. And so we find that we do have sessions where we bring as many family members in as they can on a periodic basis to try to promote the healing process, the interpersonal healing between the person who is addicted and the other members of the family that they have to be able to live with and communicate with.
Yeah.
It makes a big difference. You can't do it without that.
You can't do it without that. And it doesn't necessarily mean that it's too late. So if you have an adolescent, early adult, teen, 20-something that is having a lot of issues, that this can still be correctable. So you're looking at this from a preemptive perspective, where we're looking at the household and how things are affected because a particular child is having like an issue, but then addressing it from a whole while everybody is there. But it's never too late. I mean, and that's what we're finding. This concept of psychoneuroplasticity, it's pretty substantial, because it's saying that you can actually integrate any kind of training at any point in life. It doesn't matter what your age. Would you agree with that?
Absolutely. I mean, we have 50 and 60-year-olds who have had, very disruptive lives, and there may be still family members available, siblings or relatives, and we work with them in that regard. Now, let me bring up one other thing, and that is it's very important, if you're doing neurofeedback, to have good relationships with the various medical professionals who are also working with the patient, whether it be pediatricians, or in the case of neurological disorders, neurologists, and so on, be in communication with them to integrate the neurofeedback with their medical procedures. And in many cases, for example, we can help individuals reduce their dependency on medications. Sometimes, by the way, when neurofeedback is working well, patients who are on medications will act or present as if they're over-medicated because the neurofeedback is taking over some of the functions. And it's important for the prescribing physicians to realize this and to work with us, which they do, to try to reduce the more severe medications in a stepwise fashion so that they become as little medication dependent as possible. But we never tell patients, if you're coming into neurofeedback, you don't need medication. That's absolutely inappropriate and malpractice.
Yeah.
Whatever medications they're on, we always work with those medications.
Correct.
We try to help them reduce their dependence if it's possible.
Yes, and that is an important statement to make because it's not about an either or. Although you do have a lot of people that come in and they're pushing medications off as a last resort. And sometimes, and I see myself doing this, and I'm sure you do as well, in the process of them looking or seeking out an alternative approach to medication, there's actually a necessity for it. And so then you require them or recommend them to your neurologist and get a diagnosis and get on some medications, and so that we're working in conjunction with each other.
Exactly. Now, there are patients who come in, let's say, particularly with ADHD, the families absolutely refuse to use medications for various reasons, religious or ethical or whatever. They just say, there's no circumstance in which I will use any medication no matter what, and then the whole burden is sort of put on us. But again, if we do take a patient like that, we will take them with the understanding that we are going to work with their medical professionals in order to get the kind of result that's desirable.
Absolutely. And that's it's a very slow process. How long would you say that on average, you see some changes start to take effect when somebody does start this neurofeedback or Loretta Z-score training?
Well, yeah, let me contrast that. Back in the 70s, 80s, and 90s, when we worked with individual locations on the head, it wasn't unusual to see 40, 60 sessions for neurofeedback to become successful with long-term effects. With Loretta neurofeedback, we often get the same results in 10, 15, 20 sessions because we're dealing with more measures at the same time and more brain areas at the same time. And so the brain integrates the information more rapidly.
So it reduces the amount of visits. You can shave off quite a bit of treatments.
And reduce the amount of visits considerably.
And
you don't have to phase them out of practice very, very gradually. You just can't say, well, you've had 15 sessions, that's it, goodbye. No, you have to phase them out and follow them.
Yeah. And so it's not something that you abruptly quit. And it's something that needs to be explained in the beginning, that this is a long-term process. It can be longer in some cases than others. And so just stay the course because the results are long-lasting. Do the results of neurofeedback ever regress? Do you ever see that?
Only in the sense that if an individual has a disorder which is very amenable to, stressful situations, when they're in a very challenging situation at work, home, or otherwise, they may show some regression, but then we have them come back in and have booster sessions. And if we do that periodically, over the long haul, they do much better. Eventually, they really learn how to control it. Now, it's very, very. Let me put it this way: if the neurofeedback is done properly, with the right kind of assessment, with the appropriate database evaluation, and the patient is followed and phased out and integrated with other treatments, very rarely do you get negative results.
Yeah, and the results that do incur, they're permanent. I mean, you don't ever see those go away. I mean,
we've had letters from patients that we've seen 20, 30, even 40 years ago that are continuing to do just fine.
Yeah, I know. Channel 11 did a story on two brothers that actually came into my clinic who were struggling with ADHD and they're on medication. And I'm still in touch with the family. And one of both brothers are actually in college now. One is at UT Austin, and he's unmedicated and doing absolutely wonderful. So it's very gratifying to know that those kind of results actually happen. We're going to open up our guest line for the last segment of our show. The phone number is 214-866-8400. That guest line is 214-866-8400. We're call in and ask Dr. Lubar questions about this approach and see how we can help you out. We'll be right back after these messages.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, and welcome back to the show. We're visiting with Dr. Joel Lubar. He's the director of the Southeastern Neurofeedback Institute. Oh, I think the call just dropped. Are you with us, Dr. Lubar?
Yes, I am.
Okay, fantastic. So I want to use this segment to have guests call in and see what sort of questions they might have about this approach. The phone number is 214-866-8400. That's 214-866-8400. And while we're waiting on the line, I want to kind of go back to like some of the earlier works you've done with your colleague, and his name, I can't think of it now, but it was a study that you actually did with cats.
Well, actually, that was Dr. Barry Sturman at UCLA in Sepulveda VA Hospital. It actually is one of the studies that inspired us to try to replicate his work with humans. It was a very interesting study. I mentioned this very briefly. In the early days of the space program, when there was a rocket fuel that was being used called monomethylhydrazine. And some of the workers who used that, handled it, developed epileptic seizures. And so Dr. Sturman thought that maybe an animal model would be interesting, and so he administered the same substance to cats, and they would develop severe epileptic seizures within about an hour. And then he applied a type of neurofeedback where he trained a particular rhythm called the sensory motor rhythm over the motor cortex of the cats, and found that it would block the seizures or greatly decrease their severity. And it was based on this that Sturman and Fryer in 1971 published the first paper on a human epileptic, not exposed to that substance, but this was a human epileptic that had seizures, and showed that they were able to reduce the seizures virtually to zero using the same neurofeedback approach. And then in 1972 and 73, we started to replicate Dr. Sturman's work at the University of Tennessee, and we published our first paper on this in 1975. And then it did some controlled studies. And actually, out of this work, realizing that as these patients reduced their seizures, they became much more attentive and focused, I thought, well, why don't we try this with individuals that had what they called in those days minimal brain dysfunction syndrome. Then it was called hyperkinetic disorder of childhood, and eventually attention deficit hyperactivity disorder. It was the same thing. And that's when we found that it worked very well in helping to reduce the hyperactivity and improve attention.
And this is where you come in and say, hey, we could be using this for kids that have ADHD and learning differences.
Exactly.
And so that's where your attention moves in this direction. So anybody who's using this approach now and knows of it is actually using work that you've actually established for the field.
That's right. We were the first ones to ever do it with people.
Fantastic. I mean, and that's one of the things that I always highlight with the training that I've received is that the mentoring that I've received is from this individual. I think we have a caller. Let's go ahead and pick up. Hi, are you there? Welcome to the Therapy Hour.
Yes, I'm here.
Fantastic. You're on with Dr. Joel Lubar and Rusty.
Hey, Rusty.
Hi.
It's Ann Hardaway.
Hello.
Hi. Okay, so my daughter Charlotte has what they say is absence seizures, and in 6 weeks she's had 3 8-minute seizures where she stiffens up and doesn't move for 8 minutes. She's just as stiff as a board. Usually she looks left, and the last 2 times she's looked right. And then she had 2 of these 3 in 5 days. One last Saturday and one Tuesday or Wednesday.
It sounds like what she had are what we call tonic seizures, where the muscles become very stiff. And, actually, there's a epileptologist, I think he's not too far away from you, and that's Dr. Jonathan Walker. Rusty, do you know Jonathan Walker?
I do know Jonathan Walker.
Is he in Dallas or is he in Houston?
He's in Dallas.
That's great, because maybe he could help her right there. Because he does treat seizures using neurofeedback and gets very good results with many of them.
So have you heard of the works with Loretta Z-score in using seizure disorders?
Well, I don't know if Dr. Walker uses the Loretta approach or not. He might use the older approach. Now, the two people who are epileptologists who use Loretta, Dr. Lucas Corbeta in Tallahassee, Florida, and Dr. Robert Turner, who is in Charleston, South Carolina, both are incorporating Loretta with seizure patients.
And what kind of results are these patients getting with Loretta Z-score?
Well, at least 50% of them are reducing their seizures by 50% or more. And again, this treatment is usually reserved for those patients that are resistant to good results with medication.
Yeah.
And here's an interesting little statistic. Back in the 1970s, I worked with the Epilepsy Foundation of America. We had grants from them. It turns out that about 25% of patients were not able to be helped with medication because their seizures were so severe and so frequent. Well, I asked that question to Dr. Turner about a year ago. I said, well, with all the new medications, is it way down to 10 or 15%? Oh, he said, it's still 25%. The difference is that the medications we have today are not as toxic as they were before, but still the number of severe cases that don't respond to the medications is about the same proportion. Approximately 5 million epileptics in this country. So these are the patients that are most appropriate for neurofeedback treatment if you can find somebody who specializes in it, and preferably it should be a neurologist.
Yeah. Yeah, I know this patient, and she's been a neurologist. Excuse me. And so, and they've been through the different types of treatments, and so this is one of the approaches they're actually looking at incorporating. Let's put that number out there. It's 214-787-1190. Call in for any questions with Dr. Lubar, 214-787-1190. Dr. Lubar, let's pick up where we left off with the training with the cats and actually how it evolved into ADHD training. You've seen over the course of time, a lot of come overnight kind of therapeutic approaches and some that have actually stood the test of time. Neurofeedback has been around for a good while. When did all of this start, would you say?
Well, back in the 1960s, there were some studies training people to increase a rhythm called the alpha rhythm. It's a very dominant brain pattern of about, 8 to 12 cycles per second, rates per second, and mostly in the posterior part of the brain. And when people increase this activity, they usually get into a very relaxed, calm, and even sometimes a meditative state. And so it was people who had various kinds of stress problems were trained to produce alpha rhythm through neurofeedback, sometimes combining it with transcendental meditation or other kinds of visualization approaches. So that's one of the first applications, and this predates the seizure work, which started in the 1970s. So neurofeedback has a long history going back to the early 1960s.
That's a good stay. We have another caller. Let's take in another caller for the show.
Mm-hmm.
Hi, welcome to the Therapy Hour.
Hi, thanks. This is Michelle. I have a question. One of my children recently had a brain mapping done, and it showed excessive coherence in all regions of his brain. And I just wanted to get your opinion on what that would indicate for him.
Well, let me ask you this. When you say excessive coherence, was that in all locations and in all frequencies?
Yes, actually, we did the brain mapping with Rusty, so he can probably elaborate a little bit.
Yeah, there were coherences in all frequencies except for beta and high beta.
What yes. Increased coherence or decreased coherence?
Increased coherence.
Increased coherence.
Mm-hmm.
Okay. And there were no questions about the quality of the recording or any artifacts or anything of that kind?
No, there weren't any questions about that.
Okay, that's very important because you can get abnormal-looking coherences if there's certain types of artifacts in the EEG.
Oh, yeah, the artifacts were great. I mean, it was a great sample. It was a great map.
How old was the child?
6.
Okay. Was there any history of any kind of significant head injuries?
Yes.
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 As we're speculating that, yeah.
Okay. I mean, was the injury significant enough so that it was either concussion, hospitalization, or actual physical damage to the brain?
They would have been things that would have happened when he was an infant.
Okay.
So he did not have a concussion at that time.
Okay, but do you know what the nature of the injury was?
He was suffocated,
Okay.
so there was some physical abuse that was done.
All right. Well, you see, it's not unusual. One of the patterns there are two patterns for traumatic brain injury. One is excessive coherence, where different areas of the brain are trying to share functions that they should be doing separately. And that often happens when there's kind of an impact injury, like, impact blows to the head. The other kind of injury where there's a penetrating wound in the brain, like a bullet wound or something of that kind, then you get the opposite pattern where the connections are actually cut and you get what's called hypocoherence. There's actually a decreased number of connections in the brain. So it sounds like yours was the first type, the impact type injury. Now, again, neurofeedback is used all over the world for treating traumatic brain injury, depending on the child's level of alertness. And a very important question, I always ask anybody who goes into neurofeedback, to what extent are they willing to or motivated to really try it? Because if the individual says, I won't do it, I hate it, I don't want to do it, you can't force them to do it. You see, we always tell children, we don't take any prisoners. If you're not ready for it, maybe later on you will be ready for it. So if the child is cooperative and wants to try it, it may be, could be quite helpful.
Okay. Thank you.
Fantastic. Well, Dr. Lubar, this has been an outstanding visit with you down memory lane. I remember a lot of what you're saying as far as like your verbiage, and it's really refreshing to hear. How can people find you and your clinic online?
Well, I have a website, eegfeedback.org. But actually, if they want, if they're looking for practitioners, the best place to go, of course, the local area, they can go to UBUS. But if people are coming in from other parts of the country, they can go to ISNR.org, International Society for Neurofeedback and Research.org.
Thank you, Dr. Lubar. Thank you very much for joining us on the Therapy Hour with Rusty Lozano. Find us online at www.onlinebiofeedback. Follow us on Facebook at Rusty Lozano or the Center for Biofeedback and Behavior Therapy. And follow our radio show on Facebook, The Therapy Hour with Rusty Lozano. Thank you for joining us. Have a great Valentine's. Enjoy the rest of your weekend.